we do to develop treatments, it only matters if those innovations, if they're successful, get into the hands of patients who need them. Tell me about some of the efforts that you have that are underway that make it easier for a patient that's living with a rare disease to get access to care where they are.
In the rare disease space, we have a diagnostic odyssey, as we refer to it. It's usually 5 to 7 years to get an accurate diagnosis. And in that time, there's a physical toll as your disease may be progressing, but there's also a mental toll that places on you as you're traveling from one healthcare provider to the next, seeking those answers. And if you can do that from the comfort of your home through telehealth, instead of having to pick up, pack up, get on a plane, train, or airplane to see that provider only to be told, no, I don't actually think I can help you. That's a really big burden to relieve, and access to telehealth services has been helpful in addressing some of those issues. One initiative that NORD has underway to support more robust access to services is to have established a 40 center-wide Centers of Excellence program. The goal of bringing that care closer to home so that some of those barriers to access and treatment that arise from distance can be resolved. And so really looking to shorten the diagnostic odyssey so that more patients have the right diagnosis so they can get on the right treatment. We're also working to educate the next generation of healthcare providers and make sure they're knowledgeable about rare diseases, and then facilitate connections amongst existing healthcare providers so that when you're in Tucson, Arizona, and the knowledgeable healthcare provider is at the Mayo Clinic in Minnesota, that those providers can communicate to provide that optimal healthcare service.